Oh, well, I'll skip this and we'll start another one. The sources of evidence either are primary sources, which are the original research publications that have not been filtered or synthesized, primary original research publications, or secondary sources. They are synthesized publications of the primary literature. There are systematic reviews and meta-analysis, and evidence-based article reviews, and clinical practice and guidelines and protocols. Now, assessing evidence, we can use e-databases, Medline, the Cochrane Library for systematic reviews, evidence-based journals. There are evidence-based dental practice journals which you can resort to, and this is how you get them, and evidence-based dentistry, and this is the sites. The Cochrane collaboration is an international organization whose aim is to build a database of up-to-date systematic reviews of random controlled trials of healthcare. The main product of the Cochrane collaboration is the Cochrane Electronic Library, and it is www.cochranelibrary.net if you want to go through it. There are skills and abilities that are needed to apply EBDM. We convert the information needs and problems to a well-defined question, apply the PICO system. Then we conduct a computerized search to answer the question using the PICO system, indicate the problem, intervention, comparison, and the outcome. Then we critically appraise the evidence for validity and relevance. Then we apply the results of the appraisal and evidence in clinical practice. Then evaluate the process of your performance. I hope you're able to follow. I'm sorry that I'm not present in person to explain and take feedback from you as students and try to explain your questions. Sorry about that. Systematic reviews answers a clearly focused question. We have a comprehensive search strategy. We do explicit inclusion criteria. There is a qualitative or a quantitative analysis. We do the data synthesis, and then we do our summary of results. Example of systematic review or integrated research. For example, a focus question. The question, for example, is how guided tissue regeneration compared to open flap debridement in the treatment of periodontal infrabony defects. This is a focus question. Now, the second step, we are going to have to select the included studies. How do we select the included studies to incorporate so that we answer this focus question? We select the valid or reliable studies, for example, random controlled studies only, for instance. And we select studies that involve chronic periodontitis. And we select studies that incorporate only at least 12 months duration and nothing less. Follow up. Then the patient's age, these are the inclusive criteria, of course, should be 20 years patients or older. Also, there are exclusion criteria. For example, aggressive periodontitis. So there is chronic periodontitis research only is needed, but we exclude research that includes aggressive periodontitis. So the selection of studies should be explicit. And the literature search study will also be explicit. They use, for instance, the Cochrane Oral Health Group, Embase, Medline, etc. Hand searching can be allowed, but certain journals are only selected, like, for example, Journal of Periodontology, Journal of Clinical Periodontology, Journal of Periodontal Research, and also the year that we follow will be also specified. Then opinions of experts, groups, and companies for unpublished material can be used. So you see, it is not very simple. It is very, very explicit to do this kind of systematic review. So when you read a systematic review, you should know that it is valid and is based on subjective, not on subjective or biased research. It is very objective and valid. And further, the methods of review, validity assessment, also titles of abstracts can be included. And they're screened not by one reviewer, it's screened by 2 independent reviewers. Full text of all studies of relevance, independently assessed by 3 reviewers for inclusion in the study. Data entry onto computer performed also by 2 reviewers. So it is not easy, as you see. It is very explicit. So when you read a systematic review or meta-analysis, you should know that all these steps have been undertaken by the reviewers to produce the material that you are reading. So the outcome variables, hard tissue measurements, what do we want to find at re-entry, and soft tissue measurements, clinical attachment level, probing, pocket depth, and recession. So all the studies that are being selected should have these outcome variables. So in other words, this is what I mean by homogeneity of the studies included. The studies included should be homogeneous. And how it is homogeneous? By following these steps. Not all studies are included like the traditional review, picks and chooses, but only specific studies which apply the methodologies and selection and the outcome variables needed for each unit of the studies, and all these homogeneous studies will be integrated into one review, which you will be reading, and hopefully you will be able to give it its value because it has been very explicitly performed. All right. The systematic review or integrated studies, again, randomization is important, concealment of allocation is important, blinding of outcomes assessed, blinding of the operator, handling of withdrawals. Study characteristics. I don't want to go to further discussion into this slide. Maybe you will be confused because I'm not around to explain to you. So it is a specific time or a very special timing. So we have to get to, all right, I don't want to go into Gandhi also. Gandhi says there's nothing that wastes the body like worry, and one who has any faith in God should be ashamed to worry about anything whatsoever. So don't worry, everything will be all right. I will not go into that. I will not go into this because I've already went into other. So these are just examples. I will not go into them. I gave you one example, and one example was enough. All right. Evidence-based dentistry is time-consuming and thorough. It relies on a collaboration network of experts in systemic reviews and statisticians. Evidence should be used in conjunction with clinical experience and clinical patient circumstances and preferences to make good decisions. All right, the evidence-based decision-making, the learning objectives, I've already went through this before. So I will not go through them again. You have them typed and it will be distributed to you. And the reference will be Clinical Periodontology, 10th edition, pages 12 up to 32. You will have it distributed to you very soon, I hope. And then, thank you very much. I hope you have a very successful examinations. I'm sorry for this inconvenience. hope you got anything out of this lecture. I know it is difficult to understand by not seeing the person who is presenting the lecture. I wanted feedback from you. I wanted to see whether you understand. I wanted to be able to ramify when I can, but it is a critical situation. Sorry for the inconvenience. Thank you very much, and best wishes for you all.